Hi, my name is Pat Gates. I'm a licensed massage therapist and certified structural integration. And today I'm going to work on Krista. She's also a licensed massage therapist, and we both work out of Chagrin Valley Wellness Center. Krista's major complaint today are two things: her shoulder, her right shoulder, and her right hip. But before I put her on the table, we're going to do some observation, because tilts, rotations, shifts in the body affect how you feel. So with Krista, if you look at her shoulders, you can see how her left shoulder is more forward than her right, and the same thing with her hip. Her left hip is more forward than her right. So this whole right side is involved in part of her issue. So Krista, if you could show us your back. And on Krista's back, if you look, here's the bottom of the right scapula, here's the bottom of the left scapula, and you can see there's quite a bit difference in where they lay on her shoulders. Also, here is how it lays next to the spine, and it's not much closer, but you can see where the right shoulder is more medial or closer to the spine. So I'm going to put Krista on the table, and we're going to do some work on her right shoulder. I'm going to have her lay on her back, and if she's comfortable with her feet not up, that's good. Otherwise, we will have her bend her knees so that to take the pressure off of the lower back. And so before I kind of start with Krista, you notice that she is in a tank top and shorts. And structural integration, you are dressed to a point. You're either in for women, a camisole, a tank top, or sports bra and shorts. And shorts need to be short, like she has on today. If they're too long, you don't get to see the whole leg. And with men, it would be shorts as well. Or with women, it can be a two-piece bathing suit. So with structural integration, the touch is going to be much deeper than with muscle release therapy. So, and in muscle release therapy, you're trying to complete an action potential. In structural integration, you are trying to release the fascial planes or the septums to allow better movement. And you actually use movement in the treatment of structural integration. So when I work on her, I may have her ask her to engage muscles and create a movement which will help release, hopefully help release her shoulder. So we're going to get started now. Are you ready?
I am ready.
You are ready. So the first thing I'm going to do is try to release her pec minor. So right now I'm going to ask her to put her arm up here so that I can gently probe until I get in there. Take a deep breath. Good. Now what I'm going to ask you to do is take your shoulder blade down your back. Yeah, good. You can see it's a very subtle movement, and what I'm feeling is the tissue moving underneath my fingers. Release. So now I can get in a little deeper, and I'm along pec minor, and I'm going to ask you to do that again. Take your shoulder blade down your back, and anything that creates pain that's a 7 or above, I need to know right away. Okay, and relax. I found that pep place, didn't I? Yeah.
It was not happy there.
No, it's not happy there. All right, a little more. Go ahead. See, now you're moving better, and release. So I'm going to come out. I'll let you relax for a minute. So anything that creates a pain of a 7 or above, you're going to tell me immediately, right?
Okay.
Okay. So now I am going to come behind on her scapula, top and bottom. There we go. And what I'm going to ask you to do is to take your elbow towards your face. That's far, okay, good, that's far enough. What I want you to do as soon as, and put it down, as soon as you feel a resistance, I want you to stop the movement and come back down. Go ahead, one more. Good. And come on down. One more. Good. And relax. Holly, how are you doing?
Feels a bit better.
Feel better?
Yeah, like I can relax on the table more than I did when I first laid down.
Do you feel like they're starting to balance out?
Yeah.
Okay. So the next thing we're going to do is we're going to work some pec major. And so what I've got is close to the place where it inserts, and you're going to raise your arm slow. Yep. Come on down. Yes, stop. Come on down. So I am in pretty deep. You want to raise. And what I feel, oh, stop. When I'm asking Krista to stop, what I'm feeling is the resistance of the muscle to move. So I'm going to ask her to do it again. Oh, now we're getting a little further without the resistance. And now I'm going to have her come back down. And she should start to feel less discomfort. All right, I've changed positions. Go ahead, go up. There we go. And come on back down. So as the muscle or the tissues release, she's going to feel much less discomfort. All right. Now what I want you to do is you're going to rotate your arm towards me. We're going to take a different, there we go, movement of the arm to encourage it to move differently rather than as a big chunk like it was. There we go. How's that feeling?
A little better where you're holding it.
Yeah. And I'm trying to be as, there we go. That just let go. Feel the difference?
Yeah.
Yeah?
Yeah.
All
Yeah.
right.
A lot.
A lot. So we have one more place we're going to go, which is on the back of the scapula. And I'm going to hold, and you are going to reach towards that wall behind your head. There, that's far enough. Yeah, come on back down. One more time. Almost there. And I do feel when the tissue is releasing, I do feel that. Go on. And I also feel where it's, can you go a little further? There we go. And relax.
That one was rough.
I know. All right, and I showed you earlier where Krista's scapula laid on her back, and there was about a 3/4 inch difference between the right and the left, and right now they're pretty even. This is the bottom of her scapulas, they're pretty even. And we take it from the spine to the edge of the scapula. They're closer as to how they lay on her back. Do you want to just relax your shoulders, take your arms off the table so that you're not pushing up on them, so that you can see they're closer. And her arm, how's the neck now? How's that feel?
It doesn't catch like it did before.
Yeah, we didn't talk about that, but her neck was catching as she turned her head to the right, and it's not doing that now because we have taken some of that pressure off of the shoulder. So Thank you, Krista.